3 out of my 4 children have autoimmune conditions. They're almost all adults now.
Hello, and thank you so much for joining us on another wonderful episode of Shock Collars. I am Carrie Bigford, Outreach Director with Texans for Vaccine Choice, and today we are exceptionally blessed to have the wonderful Dr. Paula Kruppstadt, who is the founder and medical team leader for Hope for Healing, which is located in Shenandoah, and they have another office in Houston. Dr. Kruppstadt has lots of fancy letters: MD, DABP, FAAP, IFMCP, but she is one of the few board-certified pediatricians in the world who are certified IFMCP, which is the Institute for Functional Medicine licensure. She is an expert concerning PANS and PANDAS, so much so that Governor Greg Abbott himself put her on the advisory board to be appointed for a Pediatric Acute Onset Neuropsychiatric Syndrome Advisory Council. That council advises the Commission and the Texas Legislature on research, diagnosis, treatment, and education related to pediatric onset acute neuropsychiatric syndrome. And mainly at Hope for Healing, Dr. Kruppstadt offers functional and regenerative medicine consultations for all ages, and she offers a functional approach to pediatric primary care for newborns through age 21. And more than that, she is a wonderful woman who stands for medical freedom very strongly and has an incredible patient-centered care practice. So thank you so much for joining us today, Dr. Kruppstadt.
Thank you, Carrie. It's a joy to be here, and I appreciate that nice intro.
Yeah. So you are very well known in medical liberty circles, but I wondered if you could kind of expound to those who aren't in this circle what that means to be a medical provider who stands for medical freedom. Like, what does that mean for you?
You know, I think it would be good to start with the why. So as Carrie said, I'm a classically trained general board certified pediatrician, and I began my medical career in the United States Army and served as an Army pediatrician for several years before I got out of the military and moved to the Houston area. And through several years, my own health failed, and I was given some options in the allopathic or Western trained medicine world that were not useful for me and actually made me more sick. So I started looking outside the box, but I had always been encouraged by my friends, especially friends that were nurses before I went to med school. They said, you need to listen to the nurses and you need to listen to the moms because, you know, let's face it, moms have this intuitive discernment that something's not right. And I think we should listen to that and we should trust our gut. And so several years ago, about maybe 12 years ago, I kind of began my own search outside the box of Western medicine, looking for answers. And one of the things that made a tremendous difference for me, I had eaten my way up to 300 pounds, and I was depressed, and I took antidepressants for 27 years off and on, and basically was not given any other choices. And I'm like, there has to be a better way. So our family had done 23andMe, which ended up selling to pharmaceutical companies and those kind of things. So when I established my own practice, we found a private, HIPAA-compliant, CLIA-certified lab to do precision genetics that won't sell to a pharmaceutical company, etc. Anyway, I found that by knowing how my body works and by taking away certain things and by giving my body certain things, I could feel better. And eventually I was able to wean off of antidepressants. And then my own health drastically improved, and 3 out of my 4 children have autoimmune conditions. They're almost all adults now, But this journey, I opened my own medical practice in June of 2015. And part of what we chose to do was I chose not to accept insurance. And back to your first question, the why behind choosing to step out of insurance. When you are a provider that accepts insurance, you have to comply with the insurance company's guidelines. And a big one with that is by vaccinating all of the children and adults in your practice according to the CDC schedule, because it's completely financially motivated when they come in to do a chart audit or a chart review. If you don't have a medical reason why, like people with autoimmunity on immunosuppressants, they do not have to have partial live virus vaccines. And that's even in the package insert for those vaccinations. But I chose not to have someone who did not have the best patient's medical health in mind. So I chose to step out of that. And for the first 3 years that I had my practice, I didn't pay myself. And as I find new practitioners, that's a big sacrifice, training them for 6 to 8 weeks for them to be able to understand the nuances of functional medicine, which I like to say it's not dysfunctional, but it's a way of looking at someone holistically, mind, body, emotions, spiritual, physical, and you are the sum parts of who you are. And people are born with the ability to heal. You just need to give them what they need and take away what they don't need and find any infections or immune challenges that might be there. So what it means to pursue medical freedom is you have to be willing to listen to your gut, listen to your mind, and listen to your heart, and step in line with your personal convictions and beliefs. And if that requires sacrifice, which it does, to step out of that. And also, if you choose to do that, you have to have systems in place. It helps that I'm married to an attorney, but systems in place that hold us to a higher standard, and so that we can be blameless. That's our desire. We're human beings and we make mistakes, but we hold ourselves to a different standard and quality as far as the way we practice medicine, how we practice medicine, and the evidence to back up our conclusions. Because if we don't have that, we have no foot to stand on. So if there's science to back it up, as there is with medical freedom, vaccination choice freedom, then that's what we've chosen to do. That's a long answer, but that's the answer.
But it's a very eloquent answer, and it really does shed some light. We get community requests all the time for a provider who will do a medical exemption, and they express frustration that they can't just go to an office, write down some family history, and have that doctor write them like a lifetime medical exemption. And the way that you described the absolute necessity of being able to back that statement up with evidence is exactly why it needs to be that way. It's, a medical exemption isn't a philosophical or religious exemption, that we have our affidavit of conscientious belief for that in Texas. But you as a provider, or any provider signing off on a medical exemption, they're setting themselves up for scrutiny. And it's so important as a patient to respect and follow through with your provider's process of determining your eligibility for a medical exemption. Is precision genetics the best way that you have found as a provider to communicate to patients the evidence behind their beliefs or their ideas?
Yeah. I would say that every single family that has sought us out because they may have a child that's vaccine injured,
right,
or a family member with autoimmunity, or a first degree relative that's autistic, or has neurodevelopmental challenges, or an adult with neurodegenerative challenges like Alzheimer's, dementia, Lou Gehrig's disease, Parkinson's. They have this internal compass that says something's not right and I'm not comfortable putting all these aggressive inflammatory triggers into my child's body. So far we're batting 100% to support the family because there's that intuitive, something's not right. So in the state of Texas, a medical exemption requires a yearly renewal. I have no leg to stand on if I was called to give my reason why, if I didn't have objective criteria. Objective criteria is lab tests, or let's say an anaphylactic reaction, a life-threatening reaction, such as a child that stopped breathing after a pertussis vaccine, or just terrible side effects. So we have found that these precision genetics that never change, you get swapped once, it's good for a lifetime. Your DNA doesn't change unless you have like a bone marrow transplant or something like that. And it is a compass to know what to put in, what not to put in, so you're not guessing. You know, that's the thing. Everybody says, this is good for your immune system. This is good to clean your cells out. This is good to drive inflammation down. This is good to clean your whole body out and detoxify. But wouldn't you like to know exactly why? And then we deny medical vaccine exemption requests if parents have had the genetics, but they choose not to support the genetics, because it's like, why'd you bother doing it? And then we could come under fire, even though it's parental driven. So we want to collaborate with families and give them everything they need, because what's the goal? No one wants to do any harm. All of us want our children and our grandchildren to thrive and to be supported. I think another thing, Carrie, that sets us apart, you know, as a pediatrician, you know, I'm not anti-vaccine, I'm pro-patient, and I'm pro-immunization. So what's the difference? You know it, I do know. But immunization is when you've had a vaccination that stimulates antibody production in the body. So even for well-knowing hospital systems, practices, they say immunization record. Well, have they actually tested your blood to show that you have antibodies to tetanus, diphtheria, pertussis, Hep B, Hep A? The answer typically is unequivocally, majority of the time, no. No one does that, but we do. And I have seen children that come to us that are completely vaccinated that have no antibodies to anything because their immune system doesn't have the ability to build those antibodies. So we want to give parents data, help them be smart. And that's the beauty of Texans for Vaccine Choice, and something that you are at the core initiative with TFVC is teaching parents and educating them. And we try to do the same thing.
Yeah. Wanting to maintain your voice in the conversation of you doesn't make you anti what you're questioning. Just as you so eloquently stated, being a human is complex. We're a very biochemically complex organism. And the idea, we don't even have a universal diet that expresses health for everyone. So the idea that there would be a universal vaccine program or a universal antibiotic protocol or a universal anything for such a biologically complex organism as us, to me just seems not evidence-based in the slightest and more dogma-based.
I agree with you 100%. It's so nice to hear somebody else say it too. It's like, none of us are the same. So why should we have a cookie cutter approach?
And maintaining your right to choose does not mean that you're going to choose wrongly. You're choosing what's best for you. And the idea that you would have to be all in is silly. You know, the vaccine schedule itself has changed so much since I was a child, definitely since you were a child. So the idea that there would be no reason to want to maintain your voice, or that utilizing your voice would make you anti, is just false.
Right.
It's
Right.
just false.
And I never, you never want to fearmonger people, because
No.
when we function out of fear, we don't make wise choices. And we're not supposed to be fearful. We're supposed to have the ability to breathe and look at the evidence and make a wise decision. And that's another thing I love about Texans for Vaccine Choice. You equip parents how to go to the ER and how to navigate a hospital stay, especially when different voices are saying, you've got to do this and this is the law. And it's like, I'm sorry, maybe that isn't the law. And, it's interesting. I've changed 180 degrees. In medical school, I did an international family practice vaccine, and I saw children die of many, many different vaccine preventable illnesses. And I saw a grown woman die of tetanus. And so those images are in my mind. But if you think about a third world, we're here in the United States of America, where we have access to clean water. We have beautiful sewage systems, and we have the ability to choose, okay, I'm going to add this vaccine in when I've prepared the body, or choose not to. And then this is our homeopathic detoxification methodology, or this is the IV or the therapy that you can do to support your body so that you don't develop this reaction. So there's lots of ways to skin a cat and lots of different ways to support each individual's body. And I have those images in my mind, but that doesn't make me make my decisions based on fear. Like early on in my career, I thought it was my job to convince people to have vaccines. And I grieve that because I didn't know what I didn't know.
Right.
So
eloquently stated.
thanks.
Yes, there are risks on all sides of the conversation. And it's important to arm yourself with real information. I love that you acknowledge TFVC's heart. We really are so motivated to give you unbiased, factually based information so that you can truly have the informed consent to make the choice that makes most sense for you. We're not here to direct that choice in any way, shape, or form. And there are risks on all sides. And the acknowledgement that vaccines aren't this innocuous, harm-free intervention, but do carry an inherent risk. Even getting that across the message can be quite challenging with, so much propaganda and intention placed on having us believe that, it's the most harmful ingredient is water, to quote, Senator Pan from California. And, that makes it more challenging when patients come to you injured to be able to talk about that. People reach out to us unable to communicate their fears to their provider that something has happened post-vaccine injury. So what advice would you have to give to a patient or to an individual who suspected that they had been injured by a vaccine or were afraid that they were going to be? What kind of advice would you have for them to communicate with their provider or get themselves next step help?
Yeah, that's a good question. I think, and I've heard you speak, Carrie, and that's when we met actually, is that, vaccines have these immortal fetal cell lines in them, and they also have non-human cell line derivatives in some of them. They have polyethylene glycol. Many vaccines used to have a lot of mercury that we were injecting into babies less than a year of age. So they said, oh, we'll take the mercury out, but then they substituted aluminum. And there's also squalene. And there are things called adjuvants that are put into vaccines that stimulate the immune system. But also there are substances that have been known to cause disruption of what we call the blood-brain barrier and create brain inflammation or open it up. And along those same lines, because some of the same proteins that line up the blood-brain barrier also make up the gut-blood barrier. So when people talk about the gut being the second brain, it's very important. So if a parent is trying to communicate with a provider, I think that when you sign that consent, I think turning the tables on the provider in a respectful way and saying, well, can you tell me beyond a shadow of a doubt that this vaccine would not harm my child? Right. Just like getting on I-45 and not getting in a traffic accident. Can you guarantee that that won't happen to me? And obviously 100% of the providers, if you couched it that way, would say, no, I cannot. And so I disagree with what Senator Pan said in California, and I disagree with saying things that are completely unscientific when we know that polyethylene glycol and aluminum and squalene are part of many, and mercury is still part of like the multi-dose
flu shot. Yep.
Yeah, the multi-dose flu shots. So there's no way we can say that. So I would just say that before you're forced to take something, are you really being forced? Do they really have the right to do what they say they have to do with your employment or to your child? And if your child attends a school that receives any federal funds in the state of Texas, they must comply with your right to complete the state affidavit matter of conscience or philosophical objection. But if something has happened and you think that you may be vaccine injured, the only way that I could help is if I met with a person or with one of the providers. We have 6 medical providers in our practice. One is out on maternity leave. They'll be back in November, but we would want to meet with you, obtain a timeline of your life, see where you've lived, what your toxic exposures are, what your food plan is, what your nutrition is, what your sleep, your development, if it's a child, if they're meeting their milestones, your emotional, social maturity, language, etc. And then we would definitely, we really ask that everyone that thinks that they may have a vaccine injury. I don't have any evidence unless I do those precision genetics, but also based upon your history and your physical exam, because we do something called a nutritional physical exam. We feel the skin, we look at the skin, we look at the teeth, we look at the mouth, we look at the nails, we look at the hair, we look at all the other parts of your body. We do a good neurological exam, and we listen and we take all those pieces and put them together, and we order labs from LabCorp using your insurance. If you have insurance, your insurance should pay for it. If you have Quest, we will write the order with the proper ICD-10 codes so that your insurance should cover it. And then once we have all that objective data, a physical exam, laboratory values, and precision genetics, put your story together to determine what you need, what you don't need, and to prepare your body for potential vaccines, to tell you if we don't think it's a wise choice, or how to layer it in a very low and slow approach, and the criteria to give you. And we also love to use homeopathy, nutraceuticals, herbals to support the body in a way that would do no harm, but to support you or your child to recover.
Yeah, I mean, that's wonderful. I love the way you put it about how can they guarantee you're not going to go on 45 and have an accident?
Yeah, they can't.
The hard thing is that no one can guarantee you that, because the risk is real and it exists on all sides. And yet they expect the vaccine recipient to own 100% of the physical and legal risk in that process. And for that reason alone, it's so vital. I know that you're on board with that 100%, to make sure that you never lose that right to say yes or no free of coercion. Because as a vaccine recipient, that is your only liability protection, is your ability to choose if, when, and how many vaccines you receive. That was a really great example of what happens when you're injured.
I think, too, people need to remember, I know, Carrie, you've talked about it, I've heard you talk about, is that if you have an injury and you need to take your child or yourself to the emergency room, go. They can't coerce you to take something you don't need.
Yes.
And it's against the law to turn someone away that's had a medical emergency. It's called EMTALA. And, that's what we're here for. I mean, and if you've been injured, you need a tertiary care medical center that can set that broken leg or do neurosurgery or whatever. But you don't have to have any vaccinations that you don't want to have, and just say no.
Yeah. It's all about helping people understand that they're able to say no.
Yes.
Because the impression given is not that wonderful, a huge lane of choice that you present, but it's they're being told they have to get a DTaP. My kid stubbed their toe and now they have to get a DTaP. And like I always ask, why? What part of stubbing your toe on concrete equals tetanus? Like, walk me through it like I'm 5.
Right. Well, go ahead. Sorry.
I was going to say, could you maybe explain a little bit more about what a real tetanus exposure is and when indications would or would not be for that vaccine?
Yeah, that's a really great question. The other thing I was just going to say is that if you are in the emergency room and they're saying you need something, I've heard you say this, Carrie, but, it's so important. Remember how you as a parent present yourself, and you may be very fearful and scared. Just always remember, and you've said this, we say this, is that people don't remember so much what you say, but how you made them feel when you said it. So if you as a parent are always respectful, PA Jones, Dr. Jones, Nurse Jones, with a smile on your face, with great respect. And, I really would appreciate it if you would help me understand how this will help my child. And that's involving anything. If something's going down and they've got to intubate your child, put them on a ventilator, whatever, get out of the way and let them do it. They're not going to stick a vaccination in your child while they're trying to save their life. They're not going to do that. But here, when we talk about tetanus, Clostridium tetani is a bacteria that grows in conditions called anaerobic conditions. Now, you could go out and dig a hole in the dirt. I've got a parking lot out there. Just go into the little forest on the other side and dig a hole. And if we stained that dirt with the particular microscopic stain for it, we would see little tennis rods. And that's what Clostridium tetani kind of looks like. And it makes a biological toxin, meaning that when it is on something that punctures the body, or potentially with a bite that does not bleed very much, then there's what we call anaerobic conditions, meaning without oxygen. So it doesn't have to be a rusty nail. That's what everybody's used to. It could be a piece of bark at the playground. If your kid gets a piece of bark embedded, or dirt or whatever, and it doesn't bleed very much, but you can see they've got that stuck in them. It could be a very minor laceration, or it could be very deep that doesn't bleed too much, or it's at a dirty place. Like, I'll give you an example. A little boy in my practice who was unvaccinated was at a marina at age 4 and had a very nasty gash on his arm. And his mom and dad asked me, "Do you think we should vaccinate him?" And I said, it was a very dirty place right next to a boat on a marina where all this crap is flowing. And he was already taking all the tools in the arsenal to support his genetics. So I said, he's old enough. He's not autistic. He's past 36 months of age, because When you get past 36 months of age, something called the vestibulocochlear system is developed. Have you ever wondered why 4 out of 5 children with autism are boys versus girls? That's because girls develop earlier with where they are in space and communication and all these other things for the most part. But if a boy gets past 36 months of age and you do inject an aggressive inflammatory trigger into his body, he's much less likely to develop a type of immunologic reaction that causes regression of milestones. So getting back to tetanus, if you get something stuck in your skin and it doesn't bleed very much, or if you're out in the boondocks, like at a ranch, and it's a dirty, yucky cut, may or may not bleed very much. If you don't have access to a sink to scrub that thing out, clean it out, maybe put some antibiotic ointment on it, a puncture, then that is concerning to me. So what I always prepare people to do is if they've got like something stuck or it's been a bite, been a puncture, doesn't bleed very much, it was a dirty puncture, metal, wood, any foreign object, teeth, you go in, you have it looked at, and you say, Dr. Jones, Nurse Jones, PA Jones, is this a dirty wound? If the answer is yes, then what you say is, my child is not vaccinated for tetanus. My child needs tetanus immune globulin, which is an injection. It's not the tetanus shot, or IV immunoglobulin. Texas Women's Hospital has a stash of TIG right now. Some of the Texas Children's Hospital, I don't know about Memorial Hermann downtown Houston area. I don't know what they've got in stock right now, but they all have IVIG. It's like, well, my child is unvaccinated. Tetanus incubates in the body for 3 to 21 days. So I can't wait for a tetanus booster. And if my child's unvaccinated, it's going to take about 6 to 8 weeks for my child's body to make antibodies to fight it off. So something needs to kill it right now if there's tetanus in my child's wound. So you say, I need the TIG, my child needs TIG or IVIG now because no booster is going to help them. And then if you have a provider that's willing, maybe 6 weeks after that TIG or IVIG and after that nasty little puncture or bite or wound that didn't bleed very much, get a tetanus antibody level, and you may have antibodies. You never know. So that's the scoop.
Clarify, if you do experience a dirty wound of conditions that could have tetanus and you aren't vaccinated for tetanus currently, you want to ask for the tetanus immunoglobulins or the IVIG kind of generic immunoglobulins to help your body fight that infection, because the protocol of getting a tetanus vaccine either the first time or as a booster is too late after an exposure. Is that a good summary?
Excellent summary.
Wonderful. There's just so much confusion about that. And also to be aware that there's no such thing as just a tetanus vaccine available. It's DTaP, which is diphtheria, tetanus, acellular pertussis, or it's Tdap, which is a different formulation of those same components. So as a parent, it's important to understand whenever you're thinking about getting that vaccine that it's more than just tetanus, and to mainly understand if you've already been exposed to a true tetanus exposure, it's too late for the vaccine, that is a prophylactic vaccine.
Right. Very well said.
Awesome. You know how hard I work to get the information to be evidence-based. It really is very strongly on my heart to make sure the information we put in the community is accurate.
I think that there are still some TDs out there, but they've started putting the acellular pertussis, but I know that some places are trying to use their stockpile. The military may still have some TDs available too.
Okay.
So.
No, that's good. I know from the bureaucratic side down, intercombinant is the way that they're going in the future. And it's becoming more and more challenging to find even a dual valent. It's usually 3 or more.
Yeah. The thing about pertussis too is years ago, pertussis caused so many vaccine injuries and the very fussy, irritable baby that screamed, bloody murder, high fevers, inconsolable, up to 72 hours. And then they cleaned up the vaccine a little bit and called it acellular. But the various components of the proteins within that vaccine, protactin and other things, those still can stimulate what we call a biological toxin event in a vulnerable person's body. So about 21 to 24% of the population has something called biotoxin illness. Now there's all kinds of toxins. There's lead, arsenic, cadmium, mercury, but I'm talking about biological, made by living organisms, like from bacteria, mold, viruses, venom, algae, those kind of things. And pertussis was a bad one, in addition to the partial live virus vaccines. And even though a lot of, there's been all this controversy, you can manipulate an article in a study however you want to, but, typically not an appointment with a child in my practice with an autistic disorder. I'm like, these are children who've been given labels, or adults that basically go to ABA therapy. That's the only evidence-based thing. Get your affairs in order so someone can take care of them when you're not around. That's sick. So we need to think outside the box and come alongside these families, and not an appointment goes by that a parent tells me something went wrong with that partial live virus vaccine and I lost eye contact, and then the repetitious behaviors, and then this, on and on and on. And so we believe families, and that's the problem, being gaslit by the community. Oh, you'll be fine. Yeah. And
or it's a sentence, your kid's going to be banging their head against the wall forever.
Right. Unacceptable.
And it's your fault. It's...
Yeah. It's unacceptable.
Yeah, it's unacceptable. Have you had good experience of encouragement of children being recovered, either partially or fully, after an injury? Is that something that's a reasonable thing to believe could happen in your child?
We have children in the practice, and I even have, what's more exciting is that in the world of autism, people give up on teenage boys and young adult boys and young men. And we have some children with autism and young adults that are under guardianship of their parents that are gaining milestones, and, saying more words and using critical thinking. And it's like, where'd that come from? And then, instead of needing accommodations when they go to Disneyland, they're able to stand in line with everyone else. Or when I walk into our IV therapy room, just this morning, a young man said, "Hi, Dr. K." And I'm like, it's just a blessing. And when he first saw me, this look of pain on his face, and now he's articulate. We also have children, you never hear of this, that have lost the label of autism. So, you go to the developmental center at some of our children's hospitals, PD neuro, developmental pediatrician, and the childhood autism revised questionnaire, is positive, or the ADOS is positive. And yes, you're given the labels so that you can have your insurance help you with ABA therapy. But then, what if you lose the label of autism? What if the parent, like a dog with a bone, says, my child is no longer selectively mute. My child is meeting these milestones. I want you to retest them. No. They're retested. They no longer qualify. And we have that going on here, which is a joy.
That's amazing.
You don't hear about that. And that's like what wakes me up in the morning and gives me joy in my job. And it's a ministry. So
it's so important to hear those stories, because there's so much trauma and horror in a diagnosis like that for lots of reasons. I'm sure you're aware. And I love hearing that those children can be recovered and that there are offices that are doing that work. I know we're about out of time. I just thank you so much for being able to take the time to come on, Dr. Kruppstadt.
My
I
pleasure.
cannot say enough good things about this office. It's Hope for Healing. You can get their website at gettotheroot.com. They have 2 locations, one in Shenandoah and one in Houston. Every provider on that list is already included in our referral list. We refer with confidence to Hope for Healing. If you are needing questions answered from a medical status and you're in the Houston area, Hope for Healing is a wonderful practice to consider doing phenomenal work.
Thanks for that, Carrie. And one thing that if you go to the URL in the upper right-hand corner on the website, you can schedule a free discovery call. And you can let us know. We partner with health coaches because you need someone to walk this journey with you. And that's part of our plan. And we love families. We love supporting people. And if you're interested, if it resonates, just make a free welcome call. And you can ask your questions. And some of those, they would be able to direct you and let you know if we're a good fit for you or not.
Awesome. Thank you so much for tuning in, you guys. I love being able to bring new perspectives to the medical liberty conversations. Thank you again, Dr. Kruppstadt, Hope for Healing, for taking the time. And we will see you shortly. I'm Carrie Bigford, Outreach Director with Texans for Vaccine Choice, and this has been Shot Callers.
Thank you for listening to the Shot Callers podcast. Please, if you found value in this content, rate us and share the podcast with a friend. It's a great way to get the message out and to empower everyone to make informed decisions. Until next time, never forget, we are the Shot Callers.